I think that some of the obstacles that people face is dizziness is not something you necessarily can see. And so first of all, it's really hard to describe. And so when you look at somebody that's experiencing dizziness, they look normal. They don't have a limp, they don't have a broken leg, you can't see a brace. And so they look normal, but they're experiencing these troubles.
Our ENT physicians are very knowledgeable about the inner ear and a lot of other things that can cause dizziness. So for several years, we tried to just evaluate patients to see if they had an ear disorder. And if they did, then we would try to treat that or get them to the appropriate professional to treat that. If they did not, then we kind of said, well, you don't have an inner ear problem, so we're going to send you to somebody else or back to your PCP. We don't know what you have wrong. And I think probably during, the beginning of COVID, there were a lot of patients calling in just frantic to be seen for dizziness. And so I think we started looking at it differently, that maybe we need to have a different approach to how we treat dizziness. And so our practice made the decision to purchase additional audiology equipment, to start doing more testing, to look at more parts of the inner ear, to hire different professionals, and then even to hire a physical therapist in-house. Now we can try to maintain a relationship with those patients and make sure that they are getting the help they need.
Anybody at this point is an ideal patient if you're experiencing dizziness or you have some balance difficulty, because dizziness is kind of hard to describe. If you're having that sensation, I think it would be worth coming in and being evaluated by one of our providers so we can kind of weed that out and see if this is a vestibular issue from the inner ear or if it's something else.
So for anybody struggling with dizziness out in our community, there's a few ways to come and be seen by us. One would be calling our number directly. Go to our website, www.advancedentandallergy.com.